Zampo. Welcome to Bhutan This Week, our weekly news magazine program with me, Pupkam. Our top stories this week. Her Majesty Queen Mother Dojiwang Moangchuk inaugurates Bhutan Tha Institute in Mongar. Nationwide rollout of Bhutan NDI begins. And National Referral Hospital resumes special consultation services. Her Majesty Queen Mother Dojiwang Moangchuk inaugurated the Bhutan Tsar Institute in Mongar recently. The Bhutan Tsar Institute is a center that provides training on bamboo craft. The center is located at Kalapang in Salingewok.
The Bhutan Thai Institute is located just a few kilometers away from Gelpoji. Following the inaugural, Her Majesty also visited the exhibition, which had on display various bamboo products manufactured at the training center. Currently, the center has 3 trainers and 11 people undergoing basic furniture production training.
Being a farmer, I did not know the different kinds of products that can be made using bamboo. But the training here has helped me understand all this and also learn the skills needed to do it, such as making tables, beds, chairs and others.
In my village, we have plenty of bamboo and there isn't any shortage of raw materials. But we have been lacking skills and training. But now that I have the skills, I want to help minimize imports.
The institute plans to provide advanced bamboo skill training courses in the future. The construction of the center began in 2019 and was completed in mid of this year. It was funded by the SARC Development Fund. Her Majesty also met with the local community members and gave sira and atoka to the public. Later in the day, Her Majesty also met with the students of Gelpojing Higher Secondary School. For Sonam Targe in Mongar, Yishe Galson, BBS News.
The major focus of the 13th five-year plan will be on the growth of private sector. This is according to the State of the Nation report the Prime Minister presented in the Parliament last week. As per the report, the government will increase private sector investment from 40% to beyond 50% by 2029 and to 60% by 2034.
As per the State of the Nation report, the government will undertake efforts to increase the manufacturing sector's contribution to gross domestic product from 6% in 2021 to 15% by 2029. To improve market access and connectivity for the private sector, the negotiation for a preferential trade agreement between Bhutan and Nepal has now reached an advanced stage. Furthermore, works are also underway to convene the first meeting with Thailand to start developing a preferential trade agreement between the two countries. In addition, the government is exploring trade agreements with Singapore, Vietnam, South Korea, and Malaysia. They also expect to increase foreign direct investment from more than 43 billion item to 100 billion item by 2029. According to the report, the government will foster foreign direct investment by reviewing the existing FDI policy and relevant regulations to make Bhutan an attractive investment destination. Besides, the report states that the government will work to reduce the country's trade deficit to 20% of the GDP by 2029. The report also mentions key programs identified for the growth of the private sector. The programs include implementation of an integrated business licensing system as a single window for business license, pursuing accession to the World Trade Organization, and market diversification through Brand Bhutan initiatives to countries in the European Union, the United States of America, and Japan. According to the Prime Minister, some of these programs are already underway, with the establishment of GovBiz Service Center as the initial step towards accelerating the 13th Plan objectives for business-related services. The GovBiz Center, established in August this year, will function as a comprehensive one-stop shop platform for all business-related services to the general public. According to the Prime Minister's office, the government will finalize the draft document of the 13th five-year plan next week. Samtan Dolkar, BBS News.
The Public Accounts Committee recommends the Government Technology Agency, or the GovTech Agency, to review and improve the institutional and regulatory framework for cybersecurity. According to the committee, this will help in ensuring safe, secure and resilient cyberspace in the country. The Public Accounts Committee of the Parliament presented the performance audit report on the preparedness of cybersecurity in the joint sitting of the Parliament last week.
During the session, the committee presented 5 recommendations. The recommendations include the need for the GovTech agency to expand the role of existing regulators, implementation of draft national cybersecurity strategy, expediting the identification and protection of critical information infrastructures, strengthening the legal framework, and enforcement of mechanism for data privacy and protection. Although all the members of Parliament were in favour of all the recommendations, some members made 2 other recommendations. It was about giving adequate human resources to the GovTech agency and keeping official data secured within the country by abstaining from the use of counterfeit softwares for official works.
According to the committee's finding, the GovTech agency has been facing challenges like not having skilled officials. Hence, the government should provide enough human resources.
When I talked with my friends who studied technology, they admitted that we have less number of people who are with expertise in the cybersecurity. Hence, if we do not put in the recommendations as to having adequate human resources with expertise, it will help us in the future.
All the
government agencies keep their data in Google Workspace and exchange documents through it, which can be accessed by foreign countries. If we have a separate recommendation on how to secure the data within the country, it will be safer as data privacy can be maintained.
The chairperson of the Public Accounts Committee clarified that there is no need for separate recommendations, as the committee's recommendation on implementing draft national cybersecurity strategy covers all these issues.
We have recommended the use of National Cybersecurity Strategy. In this National Cybersecurity Strategy, the challenges of human resources, data security, and rules to protect the data and documents are taken into consideration. Hence, we do not find the need to include Google Workspace and human resources as a separate recommendation.
After a lengthy discussion, most of the members of Parliament did not support the 2 recommendations through a show of hand. The joint sitting of the Parliament adopted 7 recommendations on the performance audit report on the irrigation systems and 5 recommendations for the preparedness of cybersecurity presented by the committee. All 67 members present in the sitting voted in favour of all the recommendations. With additional information from Kamawandi, this is Sonam Yuden for BBS News.
The United Nations has awarded Bhutan's peacekeeping military contingent with the United Nations Peace Medal for their service in maintaining peace in the Central African Republic. 180 soldiers from the Royal Bhutan Army received the award. According to the Chief Operations Officer of the RBA, Lieutenant General Bartusring, in keeping with the royal vision of His Majesty the King, the success in peacekeeping has endeared Bhutan to the international community as a reliable partner. Bhutan deployed its first ever peacekeeping military contingent to the Central African Republic in October last year. In commemoration of the 12th Royal Wedding Anniversary, the nationwide Bhutan National Digital Identity was rolled out in the capital recently. Bhutan NDI, a digital edge wallet that incorporates the philosophy of self-sovereign identity, legally backed up by the NDI Act of Bhutan 2023, is the first of its kind. The official rollout was headed by the Prime Minister, members of Parliament and officials involved in the making of the NDI.
Bhutan NDI is a mobile application where users' authenticated digital credentials will be stored. His Royal Highness Kelsey Jimmy Namgyal became the first digital citizen of Bhutan on the 21st February this year. It was soon followed by the National Digital Identity Act of Bhutan 2023. Hence, Bhutan became the first country to enact a comprehensive law on decentralized digital identity on July 24. The Prime Minister urged individuals to utilize the platform.
We all must know the advantages of this so that you can fully take advantage of that. While we are proud to be digital citizens from today on, but if you are not able to take advantage of that, we will still be running around with the files underneath your armpit, which is what we would not want Bhutanese to be doing this. So I would like to request each and every one of us to know for sure the advantages that it provides you as a Bhutanese citizen.
Jimmy Tenzing, who is also the NDI project director, said that a few government and banking services are already on board to showcase some basic use cases.
It is no longer a vision nor a project, but a digital journey that each one of us can now begin. Whether you are a public servant, a farmer, a business person, a banker, a student, or a visitor, everyone will use their digital identity differently. But the commonality for everyone will be its ease of use, data privacy, and empowerment.
What sets NDI apart from other platforms is that users will have full control over their personal data, which is protected by law under the provisions of the NDI Act. Unlike a physical wallet, citizens can digitally share the credentials stored in the NDI wallet to avail themselves of online services. The Chief Executive Officer of Druk Holding and Investments shared how the launch of NDI app is going to change the way of doing business and availing services.
Self-sovereign identity with the blockchain technology at the back end provides that identity on the internet. It depends on adoption now. So it actually provides 100% credible identity on the internet. And hence, a lot of the services that we are talking about, like opening a bank account or even sanctioning $1 million loan, potentially can happen sitting at home.
With the national rollout today, a lot of hope is pinned on the app to significantly increase the productivity of the nation, considering the ease of availing services that the app offers. Devika Pradhan for BBS News.
In the next 5 years, Bhutan will have its first batch of medical doctors trained within the country. In a move towards improving medical education in Bhutan, 25 students will pursue Bachelor of Medicine and Bachelor of Surgery MBBS program in the country. Commemorating the 12th Royal Wedding Anniversary, the Kesagebo University of Medical Sciences of Bhutan launched the MBBS program at the Semtokazong in the capital recently.
Addressing the gathering at the launch, the Prime Minister Dr. Lutit Singh said that the new MBBS program is important in improving Bhutan's healthcare system. The Prime Minister added that this is just a start and the journey ahead for Bhutan will not be easy. According to the university's president, introducing the program in the country is expected to address the increasing need for medical professionals in Bhutan. Meanwhile, students who will pursue the medical course are hopeful the program will help Bhutan become self-reliant in producing general duty medical officers.
During the pandemic, you have seen that Bhutan faced a lot of difficulty due to the lack of doctors and health officers. We never know what the world will throw at us again. That is why, by starting the MBBS program in the country, we will be able to stand strong and help out during such times.
Starting the MBBS program in our country is important because for years we have watched as countless talented students of our country leave our country to pursue medical education abroad. So in order to stop the dependency or reduce the dependency on other countries, we need to start the MBBS program in our country.
The classes of the MBBS program will officially commence from January of next year. In the future, the program aims to attract students from other countries to study medicine in the country. For Dikil Hazm, this is Tashtekar for BBS News.
The Comprehensive Mother and Child Health Program, an important initiative to improve the health and well-being of mothers and children across the country, was launched in the capital. The program by the Health Ministry aligns with the national priority and will address both medical and social causes which affect a mother and child's health.
The Comprehensive Mother and Child Health Program is the 1000 Golden Days initiative, wherein a mother and a child's health and well-being are looked after from the day a child is conceived and until the baby attains 2 years of age. According to the Ministry of Health, the challenges facing mothers and children's health and well-being in the country are regional disparities, low utilization of healthcare services, especially in remote areas, among women with low education levels and low socioeconomic status. Further, the Human Capital Index 2022 states that despite deaths among young children and infants declining in the country, a child born in Bhutan today will only be 48% productive compared to children who have received complete education and full health care. The Comprehensive Mother and Child Health Program will improve access to and utilization of quality mother and child health services, invest in human capital, and empower women financially. The program also includes the conditional cash transfer component, where eligible women will receive cash to access and utilize key mother and child health interventions and services. Cash will be electronically transferred to eligible pregnant and lactating women. Women belonging to the bottom of the well-being distribution are considered eligible. Pregnant and lactating women who receive the cash should do regular health checkups, do institutional delivery, monitor child's growth, and ensure that children are taken for immunization on time. The policy to accelerate mother and child health outcomes was introduced by the Cabinet in 2020. Sonam Yuden for BBS News.
The National Referral Hospital has resumed the special consultation service. The resumption of the service earlier this month is expected to provide convenient and better healthcare services to the public. The hospital suspended the service in 2020 following the outbreak of COVID-19 infection in the country.
From eye checkup to endoscopy to CT scan, almost all services available during working hours will be available for those seeking special consultation services. However, patients will have to pay certain amounts to avail themselves of the services. The fees for the services range from 100 neutrum to 5,000 neutrum. Patients will have to call and make an appointment in advance. The services will be available from 4 p.m. to 7 p.m. during the weekdays.
Those who could not find time during our normal working hours, that is 9 a.m. to 3 p.m. and like corporate institutions where they want to do annual medical checkups, all those people can access our special consultation service so that their convenience is taken into account.
Some of the patients and residents in Thimphu expressed mixed reactions, while many are not yet aware of the service.
I did not have any idea about the special consultation services. I came for treatment from Paro and it's been a long time since I got here and I'm still waiting to be treated. This new measure will definitely help the rich ones, but I think it will be difficult for the poor ones to afford.
I
am very happy to hear that there are special consultation services at the National Referral Hospital now. The time extension will definitely help the patients, but I am worried if all of us, especially those coming from poor financial status, can afford the services. We may have to keep visiting the hospital just like how we are doing now.
I heard that we will have to pay in order to access this off-hour clinic service. I think it is fine to pay as long as we get the treatment in the convenient times. I think health is more important than money, so I think many will access this service.
We usually cannot meet the doctors because the hospital issues limited number of tokens while there are more patients visiting the hospital. I'm happy that we do not have to worry about this anymore because now this service is going to provide us a chance to access treatment even after office hours.
According to the hospital management, the charges for the services are revised because of the new and better equipment. Around 150 patients accessed the special consultation services in the last 15 days. Namgedim, BBS News.
The Gasa Sachu has been restored to its former glory or is made even better. The famed hot spring was washed away along with all the structure more than 2 years ago by a devastating flood. The hot spring can now accommodate up to 180 people at once and has been fitted with uniquely designed ponds and sheds. Our reporter Chenga Duji, who was at the inauguration of the new Gasa Sachu recently, sent in this report.
When the Mochu broke its bank on the 26th of August in 2021, it washed away all the Sachu ponds and its structures, including a chete nearby. The flood left a 4 million ngitam worth of structural damage and put a halt to the local economy. Restoration works began in March of this year and over 33 million ngitam was spent on the project. The unique ponds and sheds are accompanied with public toilets, showering area and dressing rooms. However, there are no shops, resting facilities or rooms for people with disabilities at the site. The new hot spring has 8 ponds and the 2 sheds for the public and 1 pond each in 2 VIP sheds. Likewise, unlike in the past, ponds for male and female have been allocated separately. The hot spring will be open around the clock with power supply and enough space.
We have 4 ponds for men and 4 ponds for women, both in separate sheds. Each pond can accommodate about 25 people. So 80 can soak at once in the shed for women and 100 can soak in the men's shed. Around 180 people can soak at once in the hot spring.
The hot spring was washed away twice by the Mochu. The river has now been diverted to prevent similar incidents in future. The district administration carried out the hot spring restoration works.
The hot spring temperature is the same as before at the source. But since the current ponds are a bit far from the source, the hot spring temperature in the pond is a little low compared to previous ponds. We found the original sources and got new ones too.
Thousands of people from across the country visit the hot spring. The Gasa Sachu is believed to cure skin problems, joint pains, and digestive disorder, among other health complications. According to the district administration, the guest house at the Sachu area fetches around 2.5 million ngitam annually, and the closure of the Sachu since the flood has incurred a loss of about 7 million ngitam.
We have constructed retaining walls using boulders along the Mochu. We have plans to construct canopies, recreational area, parking lot, and to install street lights in the future.
I could not soak in the Sachu for more than 2 years and I got sick quite often. I had to visit hospital several times. Now that the Sachu has been inaugurated, I am really happy and I am hoping my illness would reduce.
I was deeply saddened when the Sachu was washed away and remained closed for 2 years. I was worried about how the restoration will be done and if it will ever be restored during my lifetime.
The Sachu is one of the biggest contributors to Gasa's local economy. For Chenga Doji in Uandifoda, Sonam Yuden for BBS News.
That's all we have for this week. Thank you for joining us.